meeting of this particular committee. Is there a motion that we have a motion by Co-Chair Hart. Do I have a second?
Second.
Yeah, I have a second by Senator Meredith. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bauman.
Yes.
Representative McCool.
Yes.
Representative Rorks.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Yes. Motion carries. The total number of items on the agenda today are 246 contracts, and they are in the amount of $187,834,258.91. All vendors are registered with the Secretary of State's office, except item number 3 on the personal services contract for under $10,000 and under list of Kentucky State University. Do I hear a motion to defer those contracts until the April 2026 meeting from someone on this committee? I have a motion by Co-Chair Hart. I have a second by Representative. Was it McCool? You don't talk much. Okay. Thank you, Representative McCool. Okay. All those in favor vote aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bauman.
Yes.
Representative McCool. Representative Rorks.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Yes, motion carries. Next order of business is consideration of the agenda, including the personal services contract list, the personal services contract amendment list, the memorandum of agreement list, the memorandum of agreement amendment list, and the Kentucky Entertainment Incentive Program agreement list, except for those items selected for further review. Do you have a motion to consider these contracts reviewed without objection?
So moved.
I have a motion by Senator Meredith.
Second.
A second by Representative Bauman. All those in favor say aye. All those opposed, please say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bauman.
Yes.
Representative McCool.
Yes.
Representative Rorks.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries. Thank you so very much. Now, the first items on the pull list are from the Attorney General's office, and they are numbers 2 through 5 on the routine personal services contract green list. Representatives are here. You take your... If you would, just please raise your right hands for me. Do you solemnly swear to tell the truth, whole truth, and nothing but the truth? Thank you very much, gentlemen. I do have a question. Looking at contracts 2 through 5, these are 2 contracts that I see. Actually, there are 4 contracts here for $20 million each. And my question is, could you give us an idea of how much, because these are continuation, or these are actually new contracts that you're asking to be renewed, correct?
These are actually new contracts that came out of the September RFP. I think the last time we appeared in front of the committee, there were another 14 contracts that had come out of that RFP. These are the remaining 4 that just had not been executed in time to make that turn.
Okay, so we don't have a history on these particular contracts. We don't have any estimate as to how much we might use out of each of these accounts.
We do not. And again, the $20 million is the outside estimate of what those contracts could be worth if a full recovery is made. They are contingency fee contracts. For one of these contracts to pay out $20 million, the firm would have to recover $380 million for the state.
Okay, all right. Well, then that was really going to be the gist of my question. I wanted to make sure that I wasn't sure if these were new or if you were just renewing some of the older contracts.
These are new contracts that came out under that September RFP.
Okay, thank you very much. I really appreciate it. I guess I could have called you on the phone. One of the things I think we did not do is you did not identify yourselves for the record. I did not ask that.
I'm Chris Lewis. I'm the division chief for the Consumer and Senior Protection Division at the AG's office.
Will Schroeder, Senior Counsel for the Attorney General.
Thank you, gentlemen. I do appreciate your time this afternoon, and I do appreciate that clarification. Thank you very much. Do you have a motion to consider these contracts reviewed without objection? I have a Have a motion by Representative Ballman,
Second.
second by
It's Meredith. Steve.
by Senator Meredith. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Ballman.
Yes.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. The motion carries. Thank you very much, gentlemen.
Thank you, Mr. Chair, members of the committee.
The next items on the pulled list are with the Department of Highways. They are number 8 and number 9. If we have some representatives here, if you'll just please come to the table. Make sure your green lights are on. Identify yourselves for the record.
Good afternoon. Eric Pelfrey, Director, Division of Professional Services.
Good afternoon, Jason Sawala, Deputy State Highway Engineer, KYTC.
Okay, gentlemen, I know you guys you're familiar with being here. Could you please raise your right hands? You solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
There.
Thank you very much. My question, and I'm probably asking the same question over and over and over, but again, part of this is so that the people of the Commonwealth understand what we're doing with their money. Could you again go over what you mean by alternative delivery support?
Yes, sir. So alternative delivery is a contract mechanism that is different than what we would typically do at KYTC, which is design, bid, and then build a project. Okay, that's kind of the standard procurement model for construction contracting. Alternative delivery includes things like design build, progressive design build, contract manager, general contract, or construction manager, general contractor, and other methods that do early contractor involvement in things in specific project instances where that may be helpful to foster innovation, improve speed and timeliness, or reduce costs. So it's an alternative method of procuring construction contracts.
So it has to do with procuring the contract, but doesn't it also speed up the delivery of the project that you're hoping to complete?
It could. That's one of the things that may happen with alternative delivery. So I mean, each project is different, and so depending on the type of project and what the particular circumstances are, alternative delivery can be used in that way. Yes, sir.
Okay, I think that is likely the way that a number of people in my district are hoping for in the conversations that I have with them. Thank you very much, gentlemen. Do I have any other questions from anyone? No? Okay. Do we have a motion to consider the contract reviewed? Okay. I have Representative Hart or Co-Chair Hart. What about a second? Okay, Representative Ballman. All those in favor vote aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Ballman.
Yes.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries. Thank you so very much for being here. I know that, and I probably will continue to make sure that we all understand and that the public understands, because some of these things don't mean a whole lot to them. But I really thank you for the time that you've taken to come in today. Thank you very much.
Thank you.
Thank you, sir.
Next items on the pulled list are with the Kentucky Horse Park, the Kentucky Horse Racing and Gaming Corporation. They're number 27 through 34 on the routine personal services contract list. If the representatives are here, and they're making their way to the table. Make sure you pull the microphones close to you. Make sure that the green light is actually on before you speak. Co-Chair Hart has some questions on number 28, 30, 32, and 34. And Senator Meredith will then follow up with questions on number 27 through 34. If you would, introduce yourselves for the record.
Katie Smith, CFO at the corporation. Jamie Eads, CEO of the corporation.
Ashley Bailey, Chief Legal Officer of the corporation.
Raise your right hands, ladies. You solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you very much. Co-Chair Hart.
Thank you, Mr. Chair. My questions concern the maximum hourly rates in these contracts. I understand from the attached letter that at times higher rates may be necessary to secure certain expertise. However, I know significant disparities for what appear to be the same services. For example, contract number 28 lists $495 per hour, while contract number 30 lists $300 for the same service, and a similar difference appears between contracts 32 and 34. Could you maybe explain that and give us an understanding of why that is?
Sure. Thank you, Representative Hart or Co-Chair Hart. One of the reasons that we put out this RFP in accordance with our procurement policy was to get a stable of law firms that we could pick between, because as the corporation's grown, we now have oversight of both charitable gaming, sports betting, and horse racing, which puts our licensee base, we have 35,000 plus in racing, another thousands of sports betting, and then probably 800 to 900 charitable gaming licensees. So we wanted to have the opportunity to make sure there's no conflict of interest when we have to engage with one of the law firms that we've selected. So we had 4 firms that applied, and all 4 we awarded the contract to.
So, I'm going to restate this just to make sure I understand it.
Okay.
So all 4 law firms that submitted bids, they all got awarded a contract.
Yes, correct. We do not anticipate going to the full maximum that we put each contract for. We just wanted to have the flexibility in case there was a conflict with one licensee to use another firm that had applied.
So like the contract that was for $495 versus the one that is for $300, there's a possibility you won't be charged or won't be billed for the $495 now.
We would go with the right fit and the lowest price. I mean, first and foremost, we would use our in-house. We have 2 attorneys in-house, and if we could handle it there, we would. In the event that it's so complex that we feel like we need to use outside counsel, we would go with the best option that doesn't also have a conflict with one of our licensees.
All right, well, thanks. That's all the questions I have, Mr. Chair.
Thank you, Co-Chair Hart. Senator Meredith.
Thank you, Mr. Chair, and thank you all for being present today. And I can't think of anybody that's in this room that has a better understanding of my aversion to retroactive approval contracts than Ms. Smith here. We have a long history together, a good history. I tried to read the explanation that was given, but it still wasn't clear to me as to why these are brought to us retroactively. So can you educate me?
We followed our procurement procedures, and we're required to get our approval from our finance committee and our board before we can start working on entering into the contracts. So we got those approvals in December. We worked on drafting the contracts in January with an effective date of February 1st, got them sent out for review, and it took longer with the legal firms to get them to provide their signatures on those contracts, and we actually did not get those back until February, after the February 1st date. So that's why that there is the retroactive. We had the approvals in place, and we were hopeful to have those signed and submitted to you all by the end of January with an effective date of February 1st, but they were not signed in time by the firms.
So what happens in the future to ensure that we don't have to deal with this again?
We are going to, are you on it?
Senator Meredith, yes, these will be the first contracts that we've had as the corporation for outside legal counsel on these types of issues. And each contract, if you might have noticed, has the option for renewals. So obviously going forward, if these contracts are renewed, that would make a much more seamless process to get those signed and to the committee prior to the effective date.
So what you're doing is promise me this is not going to happen again. Is that correct?
Do the best we
We're doing the best we can. A lot of these contracts are new from the transitioning away from the state. So that's why we're trying to get them approved, and then in the future, get them done much sooner.
That's all I have, Mr. Chair.
Okay. Thank you, Senator Meredith. Senator Thomas.
Let me ask the 3 of you this, Janie or Katie. Was any work ordered before the contracts were signed? Were any of the attorneys engaged?
No.
No. What about the emergency?
That was already, that's a different contract.
No.
Okay, so there was no billing done?
No,
No billing's been done yet.
I don't believe we've had engaged with any of them for that, right?
No, the previous contract that was approved by the Government Contract Review Committee last month, that has gone forward, but not any of these.
Okay. All right. May I also comment on another thing, Mr. Chair?
Proceed.
Yeah, as I've said before, I think our 125 rate is outdated, and I've said it several times, and I'll say this again. I think we as a committee, after session is over, need to convene and work to update that rate. I mean, 120 it's just not viable today. I mean, to say that we're going to expect people to come in for 125 an hour, it's just not happening. And you're talking about excellent firms here. I mean, I know these firms: Ross Brown Todd, the Bingham Greenbaum firm. These are top-notch firms, and so their average. I mean, to get them for $300 is in my opinion, is less than their market rate. Their market rate generally is somewhere between $450 and $550 these days. And so I just think we've got to bring our statutes in lines with market reality when it comes to law firms. So I want to make those 2 points.
Thank you, Senator Thomas, and we will keep that in mind. Your questions were answered, Senator Meredith, as was yours, Representative Hart. Okay. So I have a motion to consider these contracts reviewed without objection. I have a motion by Senator Thomas. And I have a second from way down there on the end by Representative Rourke. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Ballman.
Yes.
Representative McCool.
Yeah.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. I want to thank you, ladies. The motion carries. We always enjoy having you here. At least you all smile.
Thank you very much.
Thank you very much for your time. Next item on the pulled list is with the Transportation Office of the Secretary. It was number 42 on the routine personal services contract green list. I know the agency had previously requested to defer this contract until April, until our next meeting. I think after some consultation, that is what we're going to continue to do. Thank you very much, gentlemen, for waiting around. But do I have a motion to defer? Have a motion by Representative Hart, Co-Chair Hart.
Second.
Have a second by Senator Meredith. All those in favor, please say aye. All those opposed, say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas.
Aye.
Representative Ballman.
Yes.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries. Number 52 will be deferred. The next item on the pulled list, or the items, are with the Department of Community-Based Services. They are numbers 2, 3, and 4 on the Personal Services Contract Amendment Ivory list, and number 12 on the Memorandum of Agreement yellow list. If the representatives are here, they're making their ways to the table. Thank you very much. Would you please identify yourselves for the record?
Charity Roberts. I'm the branch manager in the Division for Prevention and Community Wellbeing.
Angela Blankenship, and I'm I'm the Family Preservation Reunification Specialist.
Ms. Blankenship, would you make sure that your green light's on and
There we go.
please identify yourself again, please?
Sure. Angela Blankenship, Family Preservation Reunification Specialist with the Cabinet for Health and Family Services.
Thank you very much. Would you ladies raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you so very much. I have a question on one, and then we'll move to Representative Ballman. My question is on the contract number 2. We're looking at this amount of money, and two things I want to know is do you have an idea of what percentage of this money is federal and what percentage of this is coming from the general fund? Do you have that data with you?
The $55,000 was a reduction, was actually increased to one of the, we had 5 contracts actually that were amended this quarter. And
this one was increased $55,000.
Right. So we had 2 of those contracts that were a reduction of approximately $411,000. And then we reallocated those funds to 3 contracts by the same agency. So we were just reallocating resources to facilitate and mitigate wait lists in a couple of the service regions.
So are we saying that the total amount that you're dealing with has not changed?
The total amount for the contracts has not changed with this agency. Yes.
Okay. I didn't have a second question. We see these contracts all the time, and we seek to avoid the traumatic experience of children being separated from their families. Are we seeing a reduction in not a reduction in services, but a reduction in the need for these type services? In other words, what type of return are we truly getting when we have these services? Are the number of times or the number of times we need intervention of these services, is that incident going down at all, or is that data kept at all?
We do keep data for all the families that we work with. So we do a 6-month follow-up upon after the intervention has been completed, and a 12-month follow-up. And in those cases, we see over 90% of those children being kept in the home. So at 12 months, we're also seeing that the children do remain in the home after services have completed.
Okay, another question. Are the total number of interventions changing?
We have
because and before you answer that, the reason what I'm asking is, are we dealing with populations from similar neighborhoods? And I'm trying to get at whether some of this or not, and this is not an accusation. I'm just trying to follow through on the demographics and whether some of this becomes generational. Is that data kept?
Well, like I said, we do keep all the data on the families that we work with. We certainly can do longitudinal research and provide you with that data to see whether this is generational or not.
I would love to see some of that data. I suspect that that's not been asked for in the past. And I think that would help this committee a great deal to take a look at whether we're putting money in and we're actually decreasing the need for these types of interventions, which is in fact what these contracts should be meant to do. And that is intervene in those areas. And if you could get that to my office, I would be happy to share that with the other members on the committee, if you could do that.
I'll be sure to do that.
Okay. Representative Ballman has some questions on number 2, 3, and 4.
Thank you, Mr. Chairman. And my questions are actually very similar to yours, sir. So I will yield back to you. Congratulations on the 90% success rate. That is outstanding.
Thank you.
Thank you.
Okay. Thank you. Just one second. Thank you very much. Just a little house cleaning here. With that being said, do I have a motion to consider contracts 2, 3, and 4 reviewed without objection? Okay. Representative Hart and Representative Ballman. All those in favor, please say aye. All those opposed, say no. Clerk, please call the roll.
Senator Meredith. Senator Richardson. Senator Thomas. Representative Ballman.
Yes.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries.
Thank you.
Thank you very much, ladies.
Good afternoon. I'm Roger McCann. I'm the Director of the Division of Family Support within the Cabinet for Health and Family Services.
Please raise your right hand for me. You solemnly swear to tell the truth, whole truth, and nothing but the truth.
Yes, sir, I do.
Thank you very much. I actually have a question on contract number 12. And I'm sure you have some really good answers here. That's almost a 50% increase. Could you help me in describing some of the activities and how some of the activities that you're doing, because it's low-income energy assistance programs. We hear all these wonderful words, but usually we have no idea what occurs. And then I see provide funds to administer federal low-income home energy assistance program. Give me a description of what we're doing.
Absolutely. So this contract is for the LIHEAP, the Low Income Home Energy Assistance Program. It was created by Congress in 1981. It went into place in 1982. It's been there and operating since then. This is federal funds. This is not state general funds. And although we always want to be held accountable for all tax dollars, just want to point that out. And so what this contract modification is doing is these were federal funds from fiscal year 25, so the prior October that had the program running. This contract was issued July 1 on the state fiscal year. Those funds are being spent out in October. Actually, it was a little after October because of the federal shutdown. Congress appropriated more LIHEAP money to states. So this modification is placing the new federal fiscal year money onto this contract. What the program does is there's a couple things. Predominantly, it's a bill payment program. There's different components, heating and cooling components in Kentucky, because we're one of those middle states. But also there's a subsidy component, which is like a credit for folks that are heading maybe into winter so that they don't go into winter with a deficit. But there's also a crisis component in this, that if people are in a situation where they're not able to afford their bills, so that they can head off a disconnect during the winter, like the winter we've had recently. That crisis component helps them keep their heat on. That's the component we're in right now. That will run through the end of March.
Okay, so I'm going to take a leap here. Since this was 2025 money that's been added onto this particular contract, are you suggesting that when we see this contract again, there will be that reduction?
This is this contract is adding the federal fiscal year 26 money that was appropriated by Congress back in the fall. We just got the notice of award and we're putting it onto this contract. So just make sure that I explained it properly.
You did. But are we anticipating that they're going to make the same grant next year or in 2 years? Because I want to know what's going to happen with this contract. I want to know what to expect should this come back across my committee.
That's a question for Congress.
Okay.
We have, as I said, the program's been in place since '82. It's been fairly stable. You see sometimes during the economic crisis of 2008, 2009, there were some additional funds. During the COVID pandemic, there were some additional funds that were made available to states. But typically, it's been about the level funding over the years, slowly increasing. My expectation is that Congress would want to pass legislation and appropriate LIHEAP money next October. But again, that would be up to Congress.
it would be, and the expectation that Congress passes legislation is a pretty pointed expectation. But I really appreciate your positiveness here. Okay, thank you very much. Do I have anyone else who has any questions? No? Okay. Do I have a motion to consider contract 12 reviewed without objection? Okay. Representative Rourke, and then of course Senator Thomas for the second. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith. Aye. Senator Richardson. Senator Thomas. Aye. Representative Bauman. Aye. Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Thank you very much. The motion carries. Thank you for the explanation, and thank you so very much for your time.
Thank you.
The next items on the pulled list are with the behavioral health, developmental, and intellectual disabilities. They're number 2 and 3 on the memorandum of agreement yellow list. Okay. If you would, please make sure that you can reach the microphones, make sure your green lights are on, and please introduce yourselves for the record.
Good afternoon. I'm Rachel Dockel. I am the Director of the Division of Administration and Financial Management for the Department of Behavioral Health, Developmental, and Intellectual Disabilities.
Thank you.
Afternoon, Alan Brenzel. I serve as the Medical Director for the Department of Behavioral Health, Developmental, and Intellectual Disabilities.
Hi, good afternoon. I'm Wesley Duke. I'm the General Counsel at the Cabinet for Health and Family Services.
Okay. Thank you very much. Please raise your right hands. You solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
I do.
Thank you very much. I guess I'm going to address question number 2, and then I'll have Representative McCool address question number 3. But I'm looking at the increase, and I'm missing something. It says for administrative personnel to the Kentucky Correctional Psychiatric Center. How many personnel?
I don't have a listing of exactly how many personnel are involved with it. However, the contract does specify a minimum number of personnel that that 7 counties provides for administration of KCPC. So it runs down at, and when we are talking about administrative personnel, we're actually leaning heavily into clinical personnel. So we're talking about a director of forensic psychology, a psychologist, licensed program administrator, psychological associates, program administrators, physicians, forensic directors, so professional clinical staff that are required to administer KCPC.
Would someone be able to get me information on how many personnel we're talking about?
Absolutely.
And I need that sooner than later.
We can provide that for you.
Yeah.
Okay. So I'll hold off any other questions until I get some of that information. In the meantime, Representative McCool, you have a question?
Yes, Mr. Chairman. Thank you, and thank you for being here. Thank you, Mr. Chairman, for allowing me to ask this question. I know this is federal dollars, but it's my understanding that currently there's a long waiting list for services under the support for community living waivers. If that's correct, could you explain the rationale for decreasing the funding for this program while increasing the funding for the UK Medicare waiver nurses?
I think we're actually going to switch out a couple of folks if we want to speak directly to contract 3 that's been pulled. We have someone here that has more subject matter expert with the waivers program that she can come forward and provide a response for you on that one.
Okay, you need me to repeat that, or are you good?
My name is Crystal Adams. I'm the Division Director for Developmental and Intellectual Disabilities Division within the Department for Behavioral Health, Developmental and Intellectual Disabilities.
Would you just raise your right hand? You solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you very much. Now you can proceed.
Certainly. So what all of the staff in this contract are for the waivers, we have to separate the nurses from the other staff for the waiver because we get a higher FMAP, a higher reimbursement rate for Medicaid for those positions. And so we were simply reallocating from one commodity line to another to accommodate the increased cost for fringe that we had for nurses this year compared to what we had anticipated from the full amount of funding.
Okay, Mr. Chairman, I still want to make sure I'm clear that it seems like we're taking from one group that still needs it and giving it to another group. Is that correct, or am I missing it?
No, this contract is just to provide the staffing for the division that does the administration of the waiver. It has no impact on the actual waiver services directly.
Okay, thank you. That's what I need you. Thank you, Mr. Chairman.
Okay. Thank you, Representative McCool. I've been assured that I'll get some of those numbers in terms of the numbers of people who are in staffing. And Representative McCool, if it's okay with you, I'll ask for a vote on both of these at the same time. Okay. Do I have a motion? I'll make a motion to consider the contracts reviewed without objection, since I will be getting some information. Anyone? Do I have a second? I have a second by Senator Meredith. All those in favor vote aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith. Aye. Senator Richardson. Senator Thomas. Aye. Representative Bauman.
Yes.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart. Yes. Chairman Douglas.
Aye, motion carries. Thank you very much, and I really appreciate getting that information. Thank you all. Next item on the pulled list is with the Department for Libraries and Archives. It's number 16 on the Memorandum of Agreement Amendment Yellow List. Thank you, ladies. If you would, again, make sure that your green lights are on. And please introduce yourselves for the record.
It was on. Sorry. Dondra Meredith, Deputy General Counsel at the Education and Labor Cabinet.
Denise Lyons, Commissioner, KDLA.
Beth Melbourne, Deputy Commissioner, KDLA.
Please raise your right hands. You solemnly swear to tell the truth, whole truth, and nothing but the truth?
I do.
I do.
Thank you. Thank you so very much. Explain to me, because I know there are some things going on in the General Assembly now, some bills that are looking into this particular area. Explain to me what's going to happen with the statewide expansion, because that's what this talks about. The funds to oversee a statewide expansion. Tell me what that means. Are we not statewide now? I guess is my question.
This is an amendment to the contract, a modification. So we have a statewide program. It's just that should a local program partner not be able to meet the needs, they do have the ability to find additional funding, including coming to us as a distressed affiliate.
And what criteria would a local affiliate use for, quote, not being able to meet the need? Help me with that.
So for this particular situation, the enrollment was rapid and far beyond what they had originally intended. And so in order to cover the cost without interruption, they were only able to find an additional month of other sources. And we provided a up to 6-month sort of bridge, if you will, to keep the program going while they seek sustainable funding.
So is the committee to understand or partially understand that this may be a one-time ask?
Correct. Yes.
I'm looking up and down to make sure my committee members heard that. You heard that, right? Okay, all right. I'm just making sure that we're getting buy-in for the program. Senator Thomas, do you have a question?
I do have a question, but I do have a comment too. First of all, I see a lot of value in this program. This program's gotten a lot of public attention in the last week, surprisingly so in some respects. But tell us, since you're really the people who administer this program, how many children and books are you serving presently? Do you have any idea?
Let us take a look and see if we find it. I think I have the annual report. Oh, go ahead.
Okay. So we request a quarterly report from the Imagination Library Executive Director, and at the end of December, we had enrolled 137,236 children, which is 51% of the total population, which is 266,500.
We're talking about children with low who qualify as
all children qualify
all
from
children.
birth to 5.
Okay.
And so those are the age ranges.
Okay. So if I understand you right, there are about 266,000 children in Kentucky as of the end of last year, 5 or less.
Yes.
Okay, that's good to know. And over half of them are enrolled in this program.
Correct.
Correct.
I don't have anything else to say.
Senator Meredith?
Thank you, Mr. Chair. I don't have any question about the quality of the program. I think we've always been very supportive of it. I'm just curious as to the flow of the money. We're increasing by $54,000, and we're 3 months away from the end of this biennial budget. It says general funds, but where did you come up with $54,000?
These are the unexpended funds from the previous year.
All right, thank you. That's all I have.
Okay. I do have one final question. What documentation's been made that these books are actually being utilized? We do a lot of wonderful things for people. I'm in the healthcare space, right? Just because I write a prescription doesn't mean it doesn't end up on the mantle in someone's home. So, again, and this is really, really a sincere question. Are we documenting, or do we have any access to document utilization of these materials?
It's my understanding, and my programmatic people can jump in if I misspeak, but it's my understanding that the Dollywood Foundation, which is the operator of the Imagination Library throughout the world, does track some of that data. Here in the state of Kentucky, we specifically have tried to foster a partnership between the Dollywood Foundation and the Governor's Office of Early Childhood in collaboration with KY Stats, the Kentucky Center for Statistics, to track our rates of enrollment and to see if we see any of that longitudinal data when they do enter school. This is a new collaboration here within the state regarding that specific data. I believe we put it in the contract last year for the first time, I think, maybe 2 years ago. So we're just sort of in the infancy of being able to, it took a while to get the contracts in place for the data exchange, but longer term, we do anticipate to be able to track specifically some of that success rate data specifically with our state children.
And that brings up a last question, and I'll let you ladies go because I'm learning a lot here. What are some of the data points? What are some of the criteria that would be chosen to assess whether the program is making a significant difference to a significant number of those who are involved in the program?
I would need someone else with that expertise to give you most of the specifics, but in general, it's my understanding that they are going to attempt to see how it is going to affect school readiness in the literacy area. And I don't know if you all have any more specific, but I know GOEC might be able to provide more specific data points.
We may be able to get something more specific, but in general, we like to see whatever we can foster through our libraries, through our partnerships, wherever we have the opportunity, and share that data across all of these groups so that we can see where there might be a need to assist in a place that we already have something set up. So Books in the Home, we know helps the readiness. The readiness has a certain number of
You
pieces
mean
to
books?
it.
You mean books in the home that are utilized?
Correct.
Okay, all right. No. I'm a kind of a word guy, and I apologize. I'm not trying to be a smart aleck. I'm trying to, have conversation that actually has meaning and has direction. And so what you're suggesting is that books in the home, in those homes that are utilizing the material, because books in the home otherwise don't make any difference, right?
Correct.
Any more than the couch.
It really is the interaction between the caregiver and the child with the book and other things that help that early learning. And we hope to be able to continue that in partnership wherever we can.
Well, I want to thank you all for all you're doing. Some of my concern is sometimes that we are changing so many variables, and we throw around the word school readiness, and I think we're losing some of our concentration on what that means, because we've got so many variables we're throwing in, and we have no idea which one's making an appreciable difference, but it's still costing us the same. That's the only reason I ask some of these questions. Representative Rourke, you have a question?
I just wanted to briefly make sure my understanding was correct too. I appreciate the discussion around data because I do think it's important to tie this program to those outcomes. But I also wanted to point out that the program, the way it operates, it's my understanding that someone has to, in the family or a loved one, someone who knows the child, has to sign that child up for the program. And what I think is really important about that is I don't have any kids of my own, but I have nieces, and I love them to pieces. So the nice part about it, though, is that it encourages someone in the family, if they thought to go out of their way to sign up the child, that usually means that they're looking for some level of involvement with the books to kind of be that adult who's fostering a love of reading with the child. And so what I really like about the program and what I think Dolly Parton's inspiration has been around like family literacy and making sure that there is a parental or a adult in someone's life to also be doing that reading and then just fostering that in the next generation. But also it helps their own literacy. I know for me, I've had to start reading books, children's books to my nieces just to get better at public speaking in general and not stumbling over words. So I think that is an added benefit, but I also think there is some data that I'm going to do some research about that correlates to like number of books on a shelf in a home and like readiness outcomes for students later on. Now, correlation doesn't always equal causation, but I do believe there has been some previous and really historic data that has kind of lended itself to that.
I certainly hope those studies will stratify according to demographics as well, because sometimes they can be misleading. Ladies, thank you very much for your answers here. Do I have a motion to consider the contracts reviewed without objection? Okay. I have Senator Thomas, and I also have Co-Chair Hart with a second. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith. Aye. Senator Richardson. Senator Thomas.
Richard, I definitely want to explain my aye vote here. May I proceed?
Yes.
Okay. I hear a lot about how we can get more parental engagement in our children. We're talking about now in this legislature building a $45 million juvenile detention center for children with mental health, which will probably be, honestly, $75 million by the time we get it done. And you have to ask the question, at least I have to ask the question, couldn't some of that money be better spent on a child at a younger age to address problems so this child doesn't become a juvenile detention, a juvenile delinquent, or become harmful to others or to himself. And I see programs like the Dolly Parton Imagination Library as a real step forward to try to encourage parental involvement in their children. I mean, we can't mandate it, but when I look at things like the Dolly Parton Imagination Library, or I look at site-based decision-making councils, those things that again, we can encourage parents to get involved in their children's lives. I'm very supportive of that. And I think those are good things that can be done to say we think parent involvement is great. Now, again, to the extent we can measure whether parents are reading to their children, I think that's going to be kind of hard to determine because we're not in the household with them. But to the extent we can do that, that's fine. What we can determine, though, is kindergarten readiness. That can be determined, and comparing those children who come from households with the Dolly Parton Imagination Library and how their vocabulary has expanded because of that compared to children who've not enrolled, and their vocabulary can be measured. And I think we ought to do that to show the good work and the progress that we can make toward both having parents engaged in their children and in their children's readiness because of the Dolly Parton Imagination Library. And finally, I have to say my good friend Representative Rourke makes an excellent point. Someone in the household, a parent or a foster parent or a grandparent, someone has to come forward and say, I want my child to have these books, okay? And so that's some kind of, you can reasonably indicate from that, because the parent or a caregiver has said, I think having these books is important, that somehow they are reading to them or they're utilizing them. That's not much of a stretch to believe that. And so for I've probably gone over 3 minutes, but for all of those reasons, I think this is a great program, and I think we ought to just encourage this as a lawmaking body. Say this is good policy for our young people and gets the parents involved in their children's lives early. And that's a good thing. So we don't have to think about building $45 million plus juvenile delinquent centers.
Thank you, Senator Thomas. Our job as legislators do include being good stewards with the money that our general public puts into the pipeline, not just helping people feel better. I think our public expects us to look at the results or the lack thereof and just make sure that we can make modifications along the way so that we can get the best return on their investment as we improve things. Ladies, I thank you very much. Were we in the middle of a vote? Continue, Clerk.
Representative Bauman?
Yes.
Representative McCool?
Yes.
Representative Rourks?
I'm going to also just briefly explain my aye vote, if that's all right, Chairman.
Mm-hmm.
Okay, so I'm voting aye today. I think this program has been incredibly popular amongst constituents and people all across the Commonwealth, and I think they really like to see their taxpayer dollars going towards this program, and because it's so much fun and they get so much joy out of it, they see a lot of benefit. And so, to quote the great legendary and wonderful role model of Dolly Parton, I'm voting aye today because you should find out who you are and do it on purpose.
Thank you very much. Thank you very much.
Representative Hart?
Yes.
Chairman Douglas?
Aye. Motion carries. Ladies, thank you very much.
Thank you.
I think this is a wonderful program for those who are electing to utilize the program, and I would just encourage you to keep up the good work.
Thank you, sir.
Thank you. Now, the final items on the pulled list are with the Department for Public Health. They're number 22 and 26 on the Memorandum of Agreement Amendment Yellow List. Do we have some representatives here? If they could just step forward. And we just have a couple of questions. And as you're getting comfortable, make sure that the microphone is close to you. Make sure that your green lights are on. And please introduce yourselves for the record.
Gloria Dennis, Ron White Services.
I'm not sure.
Sorry.
Mm-hmm.
Gloria Dennis. I'm the program manager for the Ron White Part B program.
Bob James, the Assistant Director, Division of Epidemiology.
Okay. Would you please raise your right hands? Solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you both. Thank you both so very much. I have a question on number 22. And I do understand that this is federal and and agency money. I was going to ask you a little bit about the ratio, but I guess my main question, because we do have an increase here, what is the how would you define the program working?
The reason for the increase is because of the KRS. It mandates that we have 40 clients per case manager, and currently KCCP, which is where this contract is with, serves over 2,700 clients, which is 49% of the HIV burden in Kentucky. And they have 24 case managers, and we're adding an additional 20 case managers to get the ratio down to approximately 50 clients per case manager.
Do you see any reduction in the number of clients?
No, the clients have been increasing over the years.
Okay, that was the answer I was looking for. Okay. Well, thank you very much, Senator Meredith. 126.
Thank you, Mr. Reed. I've got several questions. Unfortunately, all we get is a capsule summary of what these contracts are. It's hard to read into them, but we're increasing by $761,000. And the agreement description says provides funds for an infectious disease branch manager to supervise and coordinate the work of staff.
This is
but then on the amendment description, it says add funds for additional staffing to support the service of the Rural Health Transformation Plan. So how many people are we hiring here?
We'll substitute subject matter experts for this contract.
Is this the A team or the B team?
I'm not going to say.
Please make sure your green lights are on. Introduce yourselves for the record.
Hello, I'm Kim Beers. I am Division Director of the Division of Administration and Financial Management for the Department of Public Health.
And I'm Mike Tuggle, Assistant Director for the Department of Public Health.
Raise your right hands, please. Solemnly swear to tell the truth, the whole truth, and nothing but the truth.
I do.
Thank you very much. I'm sorry, Senator Meredith. You can proceed.
I'll already state my question since the A team or B team is now at the table. Question was, we're going to increase it $761,000, and the agreement description says provide funds to hire a manager to supervise the work, but then under the amendment description it says add funds for additional staffing. So my question was, how many people are we hiring for $761,000?
That's a great question. What is not in that description is that this modification is for the Rural Health Transformation Program. And so that staff is specifically for the leadership of Rural Health Transformation, which in this contract modification is listed as 3 positions. 2 are currently filled, and 1 is a placeholder in case they need expanded assistance.
Well, I'm also very excited to see that we're adding some personnel on the Rural Health Transition Grant Program. We're very excited about that. But in the description here it says general/federal funds. So what percentage of this is general funds and what percentage is federal funds?
It is 100% federally funded from Rural Health Transformation.
So all these funds are coming from the Rural Health Transition Grant?
Yep.
Correct.
Well, we had other documentation that said that it was going to be general funds, but you can confirm that for me that it is 100% funded for Rural Health Transition grants.
Yes, sir.
Yeah, the confusion here is that this modification piggybacked on that original agreement that had general fund for infectious disease, okay? So it was done as a piggyback rather than have its own contract due to the timeline of getting a new contract in place. So starting FY27 and thereafter, Rural Health will have its own contracts for personnel and services.
Okay, so we have, again, go over the staffing numbers for me again.
In this contract modification, there are 3 line items for the program director, the program advisor, and a placeholder for a program development manager.
So want to be hired later.
Correct, if needed.
Why are we doing this through the University of Louisville instead of just hiring the staff ourselves and report directly to the cabinet?
You want to answer that one?
I believe it was, we're not the program leads here, but it was for the expertise that the University of Louisville had expertise. These staff had expertise in leading major projects. And again, this is just not a Department of Public Health project. It is a statewide project requiring probably significant types of leadership and expertise that we couldn't recruit and or get timely enough to launch this program.
Maybe you discount yourself too much, because I'm not sure that the University of Louisville's ever dealt with a program like this before. It's kind of a cutting edge, and I think we're all going to be learning as we go along. I don't know that I agree that it should go through the University of Louisville, but it is what it is.
I'm going to step in, and I'm going to bifurcate these two contracts. I'm going to ask that we consider a motion on question number 22 first. Do I have a motion to consider contract 22 reviewed without objection?
Mr. Chair,
excuse me. I have a motion on the floor. I have a question on the floor. Okay, Representative Ballman has made a motion. Do I hear a second? Second. I have a second from Representative Hart. All those in favor say aye. All those opposed say no. Clerk, please call the roll for question number 22.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas.
Mr. Chair, I'd like to explain my aye vote.
Proceed.
Thank you. For some of the younger members on the committee, like Representative Rourke, 22 is the Ryan B. White Coordinator Program. That's what it's named for. And a little bit of history that I think you should know. Ryan White was a 10-year-old boy back in 1981 in Muncie, Indiana, which is not far from the University of Louisville. Okay? And it was discovered at that time as 10-year-olds that he had something called AIDS. Okay? And it got national attention because he was castigated by that school and stigmatized, and was not allowed to go to that school in Muncie, Indiana, because he had AIDS. Okay? And so this got nationwide attention, really brought AIDS to the forefront of America at that time. This program is named after him because this program is designed to still treat and research people who have AIDS and HIV in hopes of bringing cures. Like we've come a long way in that treatment because of programs like this, and that's why this is such a good program. Just want to let you know the history behind that, who Ryan White really is. Okay? I vote aye, Mr. Chair.
Thank you, Senator Thomas. Clerk?
Representative Ballman.
Yes.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
I vote aye. Motion carries. Thank you all on contract 22. Now contract 26. Are there any other questions on contract 26? Any other comments on contract 26? Do I hear any motions on contract 26? I have a motion by Senator Thomas. I have a second by Representative Rourke. All those in favor vote aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Let's explain my vote, Mr. Chair.
Proceed.
I'm voting no, and it's nothing that you all have said inappropriately or wrong, but I'm concerned about making this decision without really understanding what the total budget is for the Rural Health Transition Program. And with just this piece of information, it's just too piecemeal for me. I'd like to see the global budget for this as to where we're going to anticipate spending each of these dollars that we're receiving, and get some sense of how much is being spent on personnel, how much has been spent on infrastructure, and things of that nature. So I just need a little bit more information than what I received today. Again, no reflection on the answers you folks have given. Just I can't make a decision within this narrow space.
Continue, Clerk.
Senator Richardson. Senator Thomas. Aye. Representative Ballman.
Yes.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
I too am. I'm going to vote no, and I'm going to have to echo some of the things that Senator Meredith said. And these votes aren't personal votes; they're actually informational or lack of informational votes, at least for me. The contract will move forward. Thank you so very much for your time, and thank you so very much for the information. So the motion carries. Before adjournment, we will be having a meeting in April. I think that because of some conflicts, it will not be on Tuesday. It will be on Monday, April the 13th, and I will leave it up to my co-chair, Hart, to give us an idea what time of day that meeting will be. So that will be announced. Do I have a motion for adjournment? So moved. Thank you. We're adjourned. Did we make it?
It's so quiet this year. We're getting